Hello everyone, my name is Ethan Laux. I am a second year kinesiology student at Western University, and today I will be taking you through some components of a 30 to 40 minute workout video for spinal cord injury patients. A spinal cord injury can result in loss of somatic, sensory, and autonomic functions below the lesion level. Individuals with a spinal cord injury have a high risk for development of secondary conditions such as shoulder pain, skin pressure ulcers, chronic pain, problematic spasticity, joint contractures, depression, obesity, and diabetes. Therefore, it is critical for the population to keep an active to ensure a good quality of life and ability to complete activities of daily living without undue fatigue. The spinal cord injury level and completeness have direct impacts on physical function and metabolic and cardiorespiratory responses to exercise. It is crucial to take into account the spinal cord injury lesion level when prescribing exercise for those with complete spinal cord injury. So before beginning an exercise program, consult a physician. The goals of exercise training include the prevention of deconditioning, improved wellness, improved muscular strength and endurance, and flexibility for functional independence, which can lead to less sports injuries and less falls. Some precautions the participant should take before exercising is that they should empty their bowels and bladder or urinary bag before participating in the exercise. This is because autonomic dysreflexia can be triggered by a full bladder or bowel distension. Also, to ensure safety of the participants, make sure that their wheelchairs have their stoppers on to prevent unwanted movement. Lastly, it is recommended that participants' heart rate stays within a range of 140 to 170 beats per minute, and the rate of perceived exertion is from 9 to 14 range, which is somewhat light to somewhat hard. Ratings can be influenced by psychological factors, mood states, environmental conditions, exercise modes, age, and thirst. So throughout the workout, it is key that the instructor control for as many variables as possible. Some signs of termination would be that during exercise, autonomic dysreflexia results in an increased catecholamine release, which can increase oxygen, heart rate, and blood pressure and exercise capacity. Blood pressure may be elevated to excessively high levels. In these situations, immediate emergency responses to decrease blood pressure are needed, like stopping the exercise right away. Individuals with spinal cord injuries tend to have higher core temperatures during endurance exercise, and they also have lower sweat rates. The following factors reduce heat tolerance and should be avoided: lack of acclimatization, dehydration, glycogen depletion, sleep loss, alcohol, and infectious diseases. During training and competition, the use of light clothing, ice vests, protective sunscreen, and mist spray are recommended. If the individual is still experiencing excessively high core temperatures, the exercise should be terminated immediately. Lastly, if the participant is experiencing any pain or discomfort, they should stop the exercise immediately and consult a physician. Some tips before we begin: make sure you have your shoulders down and back to maintain good posture. Those with higher levels of injury scoot forward and lean back. And those with a lower level of injury scoot to the front of the chair. By doing so, you can challenge your balance and engage the trunk muscles more than sitting straight against the back of your chair. For some participants, they might need a trunk strap to keep the individual stable depending on the strength of the trunk muscles and the severity or level of injury. For the purpose of time, we will not be demonstrating the exercise for the full 20 to 30 seconds, just a brief introduction. Alright, let's begin with the warm-up. The warm-up exercises include neck stretch, tilting your head to each side, maintain good posture. This will be 40 seconds in duration. Then we have march, swinging your arms, working on getting your heart rate up. Your rated perceived exertion should be from 6 to 9, which is extremely light to very light. Next, we have swing backs, alternating arms, modification of the march. Then we have roll shoulders backwards and forwards. These will be completed for 20 seconds. Then we have arms up and down. Great job, you're doing great. Then we have flying birds. Remember to switch each time. Great job. Then we have punches. Great job. Try not to overexert yourself as we are still warming up the body and muscles. Lastly, we have arm circles. Great job. These will be completed for 20 seconds in duration, and then our warm-up will be almost completed. Okay, so now we will be moving on to the workout portion. Alright, so Intensity can vary for individuals. For beginners, it should be moderate intensity for 40 to 59% of their heart rate max. Athletes should be 75 to 90% of their heart rate. So each round of exercise will approximately be 6 minutes in duration, with each exercise being 20 seconds 3 times through, therefore being 3 rounds of exercise circuits. The conditioning segment would then be 20 minutes. However, for the sake of the video, we are just demonstrating how to do the exercises. The first exercise is bicep curls. Make sure you are working through your full range of motion for this exercise to achieve the benefits. Then we move on to tees while maintaining good posture by not arching the back. Moving on, we have single overhead reaches. The more we get into the exercise, the more we can progress into harder exercises. Okay, now we have single punches. Great job. You're doing great. Hooks are next. Remember to focus on form. Then we have swimmers. Extending your arms out while contracting your core simultaneously for full effect. Moving on to the next round of exercises, we have Ks, making the letter K with your arms. Then we have low circles. Remember to push yourself to keep your heart rate aerobically high. Then we have high circles. Then we have diagonal claps. Don't bend your arms while doing this to have good form. Then we have field goals. You're doing awesome. And taps. Lastly, in and outs. Great job. You're doing awesome.
I've always been the one to say the first goodbye. Had to love and lose 100,000,000 times. Had to get it wrong to know just who.
Awesome job. That was a great workout. Now we're going to focus on the cool down portion of things, which will be 10 minutes in duration, and intensity should range from 120 to 90 beats per minute for heart rate, and have a rate of perceived exertion from 6 to 9. All muscles should be stretched slowly, especially spastic muscles, to minimize elicitation of stretch reflexes, which can aggravate muscle imbalance and contracture. Emphasize prime mover muscles of the chest, interior shoulders, and shoulder internal rotators. Adjacent joints must be stabilized to stretch the intended muscles/tendons. Remember to focus on your breathing and calming the heart rate. This is the most important things, as we do not want to get sore muscles that have been broken down and teared from the workout. Here you will see some decompression exercises of the spine. This will reduce impact on the spine and help some relief. Alright guys, that's the end of our workout. Thank you everyone. I hope you can utilize these exercises into a 30 to 40 minute workout and stay active.